Hello everyone, my name is Pablo Leite. I'm a neuromaxillofacial surgeon. I am here to describe you how the software Nemofab from Nemotech could be used to show us the distance between the inferior alveolar nerve related to the surrounding bone. That's an important landmark, an anatomical landmark, to avoid injury to this nerve during the surgical procedure. First of all, how the nerve was located at the CT. We can see here that the CT, at this specifically at this CT, this craniofacial CT, we locate the nerve previously. You can demarcate the nerve, and then after you demarcate the nerve, we can create a mesh with this nerve, as we can see here. You have initial nerve. Then thereafter, when you have the mandible at the final position, you have the inferior alveolar at the final position of the nerve. But let's work on the initial nerve position as you can work, because as when you perform the initial osteotomies, you perform at the initial position. Visualization, initial position, and as you can see here, the initial position. You can give to this initial position some opacity. That's important to see the nerve. Here you are. You see the nerve. You can give some opacity to this proximal segment too. And here you have the nerve. I will delete all the measurements initially made for the purpose of understanding better. As you can see here, how perfect we can understand the course of the inferior alveolar nerve inside of the mandible. The first thing you need to have in mind is that as you have this initial position, as you can see here, you have the initial position of the mandible, you can study where you are going to put our osteotomy. If you have a nerve who cross too low at the mandible, it's important to put the nerve, the cut behind, because as far as you can cut from the nerve, the better result in terms of the nerve regeneration or nerve recovery you have after the surgery. At this case, probably I'm going to change the osteotomy location. I put it much more posteriorly because I have more room to cut the bone. As you have more room to cut the bone, probably you have a better osteotomy site, or you avoid the chance of a bad fracture. And here you are, you have the nerve, one more time, and as soon as you have the nerve, I can measure the distance of the nerve from the base of the mandible. For sure, this is a 2D view, but it is really helpful. You can measure here. As you can see here, this is the distance. I can measure it. I can give this fragment some opacity. You're going to have 7 millimeters. It's really safe to cut behind the second molar. That's important because you can change our mandibular osteotomy in relation or aiming to avoid nerve damage. That's important. You need to think about it. Thank you so much everyone for participating of this video. I hope to see you again at the next videos.